here today to chat just a little bit about comfort nursing. Hi, I'm Louise. I'm a mum of two, a lactation consultant, and a pediatric sleep specialist, and I'm the founder of Mother Nourish Nurture. So what's the deal with comfort nursing? Well, comfort nursing is pretty much as it sounds. A baby latches on, takes some milk, and then stays latched for a day, a week, a year. I'm only joking. So comfort nursing is genuinely a thing, and it's not a bad thing. In fact, there's loads and loads of benefits that can come from it. Let's have a look. The first benefit is going to be all about nervous system support. So when a baby sucks, we know that their nervous system is regulated, and we see them behaving like this in the womb. So this isn't something that anybody's created with some sort of a bad habit. This is a primal reflex, and it's very, very biologically appropriate. The second benefit links in really nicely to that nervous system support, and it's all about stress reduction. So studies show that when babies comfort suck, they actually have a reduced level of stress hormone, or cortisol, in their system. Something that often gets forgotten in this conversation, which is really important, is that having baby latched on for that little bit longer can also boost mum's milk supply, because breastfeeding works on this principle of supply and demand. So the more that a baby demands milk, typically the more milk that mum's body will make. How does a baby demand it? Literally by stimulating the breast. And what better way than comfort nursing? Studies also show that non-nutritive sucking will also reduce the likelihood of SIDS. This is why it's a widespread recommendation for babies to sleep with a pacifier or a dummy. Comfort nursing does exactly the same thing. Another benefit of comfort nursing is pain relief. Now this is huge. Research shows us that the babies who are allowed to suckle during medical procedures actually have a lower pain response than the babies that don't suckle. Now we can apply this to anything such as teething or maybe gas pains, basically all those common aches and pains of infancy and of babyhood. Now something they don't often tell us is that comfort nursing actually releases an amino acid called tryptophan. So what's the big deal with tryptophan? This amino acid supports brain function. How? By supporting serotonin receptor development and also sleep. I feel like this point needs to be sung from the rooftops. Comfort nursing supports sleep. It's not a bad habit. It's not a slippery slope. It's not a rod for your back or any of those other warnings that we've been given when we have our baby fall asleep at the breast. It's genuinely a really great sleep support. A lot of the time I'll work with mums who are genuinely freaked out that their baby stays latched for seemingly a whole night or a whole nap time or a whole evening. Now, sometimes this is to do with increasing mum supply. Sometimes it's to do with regulating after a really busy day or after separation, such as daycare. So there's lots of really good reasons that baby is wanting to kind of seek that attachment and that connection. And breastfed babies do tend to do it at the breast. It can really help to remember that human infants are truly infants way after birth. We're essentially still gestating, even after we've been born. So when a baby is breastfeeding, they're not just taking milk, they're also taking in comfort, they're taking in regulation, they're taking in immunity, they're taking in so many wonderful things. And it's not just about calories. Now, is there anything we need to bear in mind when it comes to comfort nursing? Well, there are a few things. So very rarely we find babies who are struggling to gain weight, who experience pain during or after feeds, or who experience body tension as well. Now, these babies will need a little bit more investigation, but the key to remember is it's not the comfort nursing that caused any of these issues. The comfort nursing is baby's response to dealing with the issues. If your thriving baby latches on, falls asleep, and stays latched, you have yourself a very normal human infant. I hope this run-through has eased your mind and given you some valuable information. And if you have any questions, get in touch.